Hello there. Welcome to my show, COVID-19 Update by Hira for December 3rd, 2020. Yeah, today is Let's Hug Day, but please don't hug because of COVID-19. If you hug, you know what's going to happen, right? I mean, you're going to spread like COVID everywhere just by hugging. Hugging will like bring COVID into your world. Um, yeah, so please don't hug. But today is technically Let's Hug Day, but don't hug. You know, we let's celebrate Let's Hug Day. Obviously, if you're just socializing with people in your household and your children are not going to public school or school and they're always at home and you don't have COVID, you can hug your children. But if you're a nurse working at a hospital, don't hug your children. You don't want to give COVID to your children with your children ending up dying, right? So don't hug your children if you're a nurse. Um, yeah, so I mean, for you to hug your children, both your children have to be at home 100% of the time, and you have to be at home 100% of the time, right? So there's no risk for you and your children to hug. But if your children go to school, you shouldn't hug them because you get COVID. Um, and if you work outside, like as a bus driver or a grocery store person, or as a nurse or as a doctor, obviously you should not hug your children. That could be for like next 10 years. Um, but civilizations have existed with parents not hugging their children. Um, like for example, in Asia, parents never used to hug their children. I mean, it's only recently with American influence the parents hug their children, but obviously when you're a baby, you hold the children, but that's not really hugging, it's just holding it, right? Um, yeah, but hugging children, that's a fairly new concept in Asia. In many Asian countries, they still don't hug their children. Um, yeah, so maybe like all of the world is becoming Asia. But it used to be in Western nations as well, they didn't hug their children, after they pass infancy or whatever. We're kind of going back to the roots, I guess, by force. If you are working outside as a teacher, do not hug your children. If you're working outside as a post office worker, do not hug your children. There's no reason to endanger your children's lives. If you're working as a nurse, do not hug your children. Um, if you're working as a doctor, do not hug your children. If you're working as an occupational therapist, do not hug your children. If you're working as a physical therapist, do not hug your children. If you're working as a respiratory therapist, I mean, especially if you're working as a respiratory therapist, because that's a very dangerous profession in COVID-19 America, do not hug your children. Um, yeah, if you're working as a patient care technician, do not hug your children. Um, yeah, love your children, just don't hug them. You know, there's no reason for you to be the one who brings COVID-19 into your parents' kids' lives with the result that they end up dying, right? Thousands of children are expected to die from now until June 2021. Thousands of children in every state will die. We know children can die from COVID-19 because in April 2020 in New York, children start getting infected and experiencing inflammation and start dying. And I'm calling that New York virus because it started in New York. Kind of like COVID-19 started in China, so called China virus or Wuhan virus. And in June 2020, large number of late teens and 20-year-olds got infected with COVID, and some died. And in the summertime, not too many people died, but still people died. And so I'm calling that Florida virus because it seems to have started in Florida. Some mutations happen for COVID to kill more people. Yeah, so hugging is a no-no. Do not hug your children if you work outside of home and your children go to school. Do not hug. Uh, There are certain cautions you must take if you want to survive COVID. If you want your family to survive COVID as a family, you must take these precautions. Obviously, you're not a slave to what you want. I'm just giving you some good advice that would help you survive COVID. You see? Um, yeah. Um, yeah. It's a COVID-19 world. The whole world is COVID-19. COVID-19 is everywhere. Um, and so if you want a COVID-19 proof your home, um, ideally you have a, negative pressure in your home or apartment, and you can work with people who are specialists in that to create a negative pressure. It sucks the air out. So if there's any kind of virus or whatever, it gets sucked out of the room or the apartment. So you could create like a COVID-19 negative pressure room for every room in your house if you have the money to do it. Um, yeah, it's probably worth it because COVID-19 can be forever. And if you have the money, obviously. If you don't have the money, you don't have the money. But yeah. Um, we celebrate the birth of Jesus, right? So happy time. You know, I love Christmas, and I'm sure you could love Christmas too. Um, Navidad, Feliz Navidad, Feliz Navidad. Yeah, you should sing a lot of Christmas carols with your children. This may be the last Christmas you may have with your children. Some of you may lose 100% of your children. If you have three children, all three children may die, especially if you hug them every day. Um, so do not hug your children if you don't want to risk killing your children. This is a person-to-person transmission. So if you're not hugging your children and touching your children, obviously there's, if you're a mother, you have to touch your children at some point. Preferably, if you work outside of the home, you should probably wear a glove when you touch your children. Um, yeah, take precautions. You can't be too careful. Maybe you can wash your hand, your arm, your face, your hair before you touch your children. If you have to touch your children, but if you don't have to touch your children, do not touch your children. That's the best way to survive COVID. Obviously, you do what you want. I'm just giving you recommendations for surviving COVID as a family. Um, yeah, but today's Let's Hug Day, so let's Hug Day. Just don't hug though. Um, it's Christmas time. I think about all the fun Christmas seasons I spent, and I can't, forget some of the fun things I did. One of the fun things I did was little ski trip in Austrian Alps. You see the flag of Austria there in the center. In Austrian Alps with a bunch of Cambridge University students, as you see Jesus College emblem here. Um, and so, it's one of the funnest things that I did when I was at Cambridge University. So I went on this a varsity ski trip, and we took a bus. You see the bus right there behind the blonde girl, who was one of the Cambridge University students. And you see the girl seated in front of me right there on the photo. Um, and, it was a social event. We talked and chatted as we went, and when we stopped the bus, at a bus stop, we socialized, and it was like straight bus ride from Cambridge University, United Kingdom, all the way to Austria now. I mean, we had like few stops along the way, but mostly we were inside the bus. It was going, and there's a bathroom at the end of the bus. We use that, and you can see the skis here. At the end of the trip, you had the skis there, ski trip. And it was in the Austrian Alps. Like we're at the top of the mountains in the you know, uh, Au- Austrian Alps. That's where Sound of Music takes place. So it was a lot of fun. Yeah. So Yeah, and look how pretty it is. You know, the city covered in snow. When we arrived, it wasn't snowing, so you can see that there, but eventually it started snowing, and uh, it was a fun time for everyone. Um, as I've said, we're having average about 2,500 COVID-19 deaths right now. We had that yesterday, and that's like a consistent uh, daily death rate now in America. So that's from about 1,000, you know, 200 has doubled to 2,400 or 2,500. So that doubled in a few days, and it's going to double again. It's possible that 2,413 deaths or 2,500 deaths will double to 5,000 deaths by next week. So, second week of December, we may see 5,000 deaths. Um, so, how quickly the death doubles, we still have to see. It is based on several factors. If people who flew on the airplane did not self quarantine but went back to work, and there are other people at work, then probably other people at work could be infected. Either that the person who went into work may not have severe cases of COVID. He may be symptomatic or asymptomatic or like be a carrier, but he could spread it to people who can really experience severe cases. Or he may be symptomatic, but he took the Tylenols and or whatever. Um, so what ends up happening is these people who flew for Thanksgiving on the plane. There are millions of them in every like they come from every state. They go back to work and they spread it to their workers. And it's like one person who flew in a plane who is asymptomatic or is a carrier or has it starts spreading it maybe to 10 people, and those 10 people go home and hug their children, and they get it, so within the period of like 5 days after the workday starts, so Monday, Tuesday, Wednesday, Thursday, Friday, you can have people getting infected with COVID in large numbers, like millions can get infected. And if you're not tested, obviously you're not going to know that you have it. And some people will die on the way to the hospital in the ambulance. By the time their symptoms are severe, it may be too late. They may be at the death's door. So it's better to be tested early. I think everybody should get tested if you work in a workplace, because you don't know who flew for Thanksgiving. Maybe they'll tell you, maybe they won't. Um, but most likely somebody at your work flew for Thanksgiving. And so, you should get tested, because you don't know which coworkers went flying. Because if you catch it early enough, your chance of survival is higher. Then by the time you feel like, I feel sick, then they may be too late. Especially if there's no more ICU beds left or hospital beds left, then you may die. So if you get tested early and then you become positive, you can get treated, you just take 2 days off and stay at home, get rest and eat good nutritious food, and you may survive it. It's like anything, any kind of illness. You treat it early, you have a higher chance of survival. So that's why I'm saying get tested. If you work in a building or work building with coworkers, if you work in a restaurant and your state still allows you to serve customers in a restaurant, then obviously you should get tested. Um, every fast food place worker like McDonald's, Burger King, Wendy's, these people are very vulnerable because their customers may have flown, and they may not know that they have COVID, or they may know. Who knows? Um, and they can still give it to you. So if you work at McDonald's or Burger King, Wendy's, Subway, um, you know, Chipotle, these like the fast food places where you take orders from customers, then you should probably get tested. Or if you work in a grocery like Giant Food or Walmart, And I think, your employer should provide you testing, like Walmart or Giant Food, they should probably give you free testing. I mean, it's in their interest to do that. Uh, and it's going to help you, obviously. So, yeah. So we have 2,413 deaths in last 24 hours in the United States of America. So at this rate, let's say we have about 2,500. In 10 days, we're going to have 25,000 deaths. In 1 month, we're going to have 75,000 deaths. But as I said, that number is going to double. Like 2,500 deaths will double. You don't know how long it'll take it to double. It could take up to like 5 days or 10 days, or it may take 3 days. Like, meaning by the time Friday comes along, we may already have 5,000 deaths. Remember, there are 50 states. Um, so if every state doubles their death, I mean, the numbers are going to double, you know? And it seems like a lot of states are doubling their death rate right now. Many states are hitting like 200 deaths, like Philadelphia, Pennsylvania is like hitting like 200 deaths. Illinois is hitting like 200 deaths. So there are these states hitting like, who used to get around 100 deaths, now getting 200 deaths. And they're going to get like 300 deaths or 400 deaths. You see, every state is going to start increasing their death rate. Um, Especially states with major cities like Chicago, New York, Philadelphia, a lot of people flying. They may have absurd amount of increase in COVID-19 cases. Um, so, you're looking at this. Obviously, DC is very vulnerable because a lot of people fly out for Thanksgiving and fly in, like people who work for congressmen, senators, people who work for NGOs, people who work for the government, FBI agents, CIA agents, Homeland Security agents, DEA agents. Um, Anybody who flies, they're vulnerable, right? And a lot of federal government employees may have flown back home for Thanksgiving. And so this area may see an unprecedented spike in COVID-19 in the next few days. Uh, by next week, well, we don't know. Let's see what's going to happen. If they, so it's all about what people are doing. Maybe the federal agents, like people who are FBI agents, Homeland Security agents, they have N95 masks, and or better yet, they have respirators, which are advanced military grade. And maybe they didn't catch COVID, because they had all this military grade stuff. Um, but if you're a bus driver or a postal worker, you should cough up, a few $100s and buy one of those top of the line respirators with filters from Amazon. I think Amazon has this really like military grade or close to military grade respirators. And that's probably what you should invest in if you're a postal worker or a bus driver, because just a regular mask is not good enough for you because you're in a constant vulnerable environment. So um, yeah, so that's something that you may want to invest in if you're a bus driver. Um, yeah, I mean, you're driving a bus like what? Um, 8 hours a day, every day, and you don't know who has COVID, who doesn't have COVID, right? It's not like they're tested before they get on the bus. So you're very vulnerable. You see what I mean? Um, yeah, so it's unfortunate. But certain jobs are, vulnerable jobs, like being a police officer, being a fireman. Like police officers, they're very vulnerable because they have to, give tickets or, talk to people. So police departments should invest in like military grade respirators, for police officers. Maybe police unions can kind of work on that. But yeah, this Christmas time, a lot of people are going to die this Christmas season, unfortunately. Um, yeah, but I mean, obviously, 2,500 people are dying every day. That's a lot of people. And this is Christmas season, typically. So, I mean, what are you gonna do? Like hide out well, you should hide out, but you should still celebrate Christmas. So decorate your house with Christmas lights and express yourself in terms of Christmas joy. And it will be therapeutic and it could be healing for you as well and for your family. To engage in group activity, putting Christmas lights up and singing Christmas carols every day. You may die from COVID, but your family can share some special moments together, right? Before, you die or your children die. Hopefully you don't die, but you can. Especially if you work full time as a bus driver or, in Walmart or, you know, if you work in a highly people relating industries like fast food industry, you know, yeah. So I mean, it's what it is. Um, yeah, I mean, this is global pandemic that kills people, so it can't be avoided really, unfortunately. Yeah, so have Christmas joy in the midst of suffering, right? Um, Yeah, we have a total of 275,729 deaths in the United States right now. Confirmed cases are at 14,102,568 cases. Remember, we have 330 million citizens in America, so this is a drop in the bucket. You know, um, you know, so 10% of the population would be like 33 million. So it's not even 5% of the population that got COVID. So there are people who don't know anybody personally got COVID in America. Yeah. So these places exist in America. And in those places, you could hug. If zero people have COVID in your town, and no one flew out for Thanksgiving and no one flew into your town, you could hug each other anytime you want. Because there's no COVID in your town. You need somebody to bring the COVID into your town. You know what I mean? So yeah, so there are areas in America where you hug your children all you want because there's zero people with COVID in your town. These towns still exist in America in some places. So you're the lucky ones. But if you fly, then obviously you're no longer lucky. Um, yeah. So let's look at the COVID-19 cases in the world. United States is number one for COVID-19 cases, 14,102,568 cases, 275,000 deaths, 275,729 deaths. Death rate is 2%. That's going to spike up to like over 10% in the next 6 months of flu season. We have December, January, February, March, April, June to go. So, December, January, February, March, April, May, June, so it's like 7 months to go. Yeah, so it's going to be horrific because death will double every few days. So, we may hit like 30,000 deaths per day by June 2021, or maybe even higher than 30,000 deaths per day. So that's coming. I would say coming, maybe by next week, it's possible that we get 5,000 deaths per day. Let's see. We don't know yet. It may not be. And one of the biggest things you've got to remember is because only less than 5% of Americans got COVID. So yeah. So do you see COVID-19 behind me? It's like looks like great flavors of COVID. It just emphasizes that COVID-19 has different varieties. There's like thousands of mutations. That scientists are saying, and that's why I don't think vaccines will work because the mutations are like there are thousands of different mutations. Of COVID, the strains of COVID. So how are you going to block all of them out? So there's a problem of logistics, in attacking COVID virus with a vaccine. I mean, you can't assume that the vaccine is going to block out all the strains, right? I mean, that's not logical. So when we talk about varieties of COVID, you could also talk about flavors of COVID or different varieties of COVID, right? mutations of COVID, strains of COVID. These are all synonymous terms. And so United States is a problem because we have 50 different states. So there's mutations going on in every city, every town. Because so many people are getting infected, virus mutates, as a lot of people get infected. And then, you travel, these mutations start mixing. It's kind of like racial marriage, right? I think that's a good analogy. If you go to Korea, like 100% of the Koreans are Koreans, ethnic, racially, blood-wise Koreans. But if you go to Seoul, city of Seoul, you have like Koreans who made white people, Koreans who married like Black people, Koreans who married like Latinos. So that exists in Seoul. So, and then some people who are like that from Seoul, or, some white people or Black people or Latinos may go to other cities in Korea. And with their arrival, people could fall in love and get married and have children. And so you have racial mixture going on. So with travel, you could have different varieties, racial and genetic mixture. But there are parts of Korea, where 100% of the town is racially, ethnically Korean. No intermarriages, and that's like that with like parts of Germany. Parts of Germany, you have towns where there's like absolutely no racial mixture. You have places like that in England, Scotland, Wales, Northern Ireland. There are places in Africa where there's absolutely no racial mixture. Everybody's African American, 100% African. You have like different places, right? Like you have places in Russia where there's no racial mixture. So, and you have places in Turkey. There's like, Turkey has racial mixture already if you see the history, but, within the reality of Turkey, there are, I guess people of the race of like the Turks, who are 100% Turks. And, and I'm sure you can find towns where everybody's 100% Turks, or in Iran where people are 100% Persians, in Saudi Arabia where people are 100% Arabic, so these places exist in the world, but the more you travel, the more you mix, you start having mixture and new realities that pop up. Same with COVID-19. You may have different mutations going on in Virginia, in Arlington area, but if that person flies to, let's say, Louisiana, that person brings the Arlington mutations to Louisiana, it starts spreading in Louisiana. Louisiana may have its own mutations, and then the mutations start mixing with mutations, and then they create different mutations. You see how that works? So movement and mixture creates more mutations, and that's why none of the vaccines will work, because a lot of mutations are mixing. You see what I mean? And because people are racially diverse in America, that creates a problem too, from the vantage point of creating a vaccine. Maybe vaccine designers created a vaccine mostly for racially white people who have no racial mixture, and, so the effectiveness of vaccine, even if it works, will be very different from race to race, ethnicity to ethnicity, right? Because people are different. Their composition is different, different genetic similarities exist among whites, different genetic similarities exist among Blacks, among, Asians, they have different similarities genetically. So these things all exist. So, when we talk about a vaccine, you need to ask yourself, what is its composition? And, there's a lot of shady thing going on with vaccine. They're not telling us everything. So we don't really know what's going on in those labs. And so, we need details, but the vaccine makers are not providing them. And Dr. Fauci condemned United Kingdom for approving the vaccine too quickly. And so did Germany too. And the vaccine company is German, but German government condemned United Kingdom for approving vaccines too quickly. And so United Kingdom, English people, Scottish people, Welsh people, they're the lab rats. So we can see like what happens to them, when they get vaccinated. And if they die in large numbers, then we can just not take them. So at least we have like England and Scotland, Wales, and Northern Ireland, thanks to the British government, to play lab rats for us with the vaccine, and see, if it's, harmful in any way. So, we can study that, right? So that's going to help us. Um, but, United States, we have a lot of people dying. And one of the reasons maybe because we have so much movement among the states and we have so much racial diversity. Uh, it's hard to keep up. It's hard for scientists to create a vaccine that is effective for all races and all, genetic differences. And then there's obviously COVID-19 mutations that are in thousands now, or maybe more than thousands. So I don't think any of the vaccines will work because there's so many mutations. But, let's see. Yeah, I'm just being a realist here, given the fact that there are so many mutations, they have not been identified yet by the scientists. So it's kind of like, they're kind of throwing, everything they can to see if it works. It seems haphazard. Yeah, so, you know, um, I like to see like the results of vaccine study, what kind of races, and which race, what was the racial composition, genetic composition, ethnic composition, pre-existing condition composition, and what happened, and what were the methodologies they delivered to try to infect people with COVID to see if the vaccine worked. Did they try to infect people with COVID or not? So, there are a lot of these questions, that exist with the vaccine. Um, yeah, it's not very trustworthy right now in terms of whether it's going to work or not, because Pfizer and BioNTech, these companies have been a little bit shady about telling us everything. Transparency is important, because we need to see, what's inside. Because, if we don't know what's inside the study, then, what are we supposed to just take their word for it? We need to see the study, right? Study of what kind of research went on and whether it's credible or not. We need to see the data. Um, yeah, so there's a serious problem with these COVID vaccines. There's like shady clandestine kind of activity going on there with the vaccine development. So that's a serious problem. Number 2 in the world for COVID-19 is India, with 9,534,964 cases. And the death rate is at 1%, which is pretty good, and 138,648 deaths. India will spike up too, the death rate. So let's see, what happens. Brazil is at 6,436,650. Their death rate is at 174,515, 3% death rate. Russia is number 4 now. And Russia has 2,354,934 cases, 41,173 deaths, a 2% death rate. So if Russia had the same number of cases as America, they would have the same number of deaths. So obviously, stopping the spread is a priority for Russia. And France, it has 2,310,090 cases, and 54,231 have died. So it's 2%, but it's the decimal is higher in France. So, if France has 14 million cases, they would also have over 200,000 deaths. So stopping the spread of COVID is a priority for these countries. Today, California issued a stay-at-home order. California Governor Gavin Newsom. And so let's have a look at that. It's first state to kind of issue a stay-at-home order that's going to be applied inside the state. So the first article says California introduces regional stay-at-home order based on ICU capacity. So it's an interesting strategy, right? Obviously, when you're using data, what kind of data you use uh, can determine what happens. California is deciding to use ICU bed capacity as a data that motivates policy. Obviously, questions still remain whether that's the best way to go. Is it better to close down the state based on infection rates? Is it better to close down states based on death rates? Or is it better to close down states based on ICU capacity rates? So these are decisions that governors have to make. And obviously, if they choose the wrong data-driven strategy, they will pay for it. And by June, we will tell which strategies were smart and which strategies were not smart, right? Because we can compare the death rate in each state. But this is why President Trump allowing each state to make their own decision is the right way to go. And Biden's strategy that he wants to do of trying to determine everything nationally is the wrong way to go. So I believe that President Trump is superior in the way he is approaching COVID-19 than Biden. Biden, I feel, is clueless as to how to tackle COVID. So, maybe President Trump will win the election. Who knows? They're doing the recounts. President Trump is like taking everybody to court. Anything could happen in history. You make your own luck. So President Trump may end up becoming lucky, right? It's not the fact that you have all the cards that make you the winner. It's how you play the game that make you the winner. So, Biden think he may hoard royal flush in a poker game and that he may win, but, different cards are being drawn and Trump may end up winning the whole thing by January. You never know. You can never assume that Biden has won because poker game is still going. Obviously, President Trump is betting, and Biden is calling and seeing and calling him, and so the poker game is going on between President Trump and Joe Biden, and we think we're looking at the cards right now, but we may not be looking at the cards. So maybe Biden doesn't have royal flush. Maybe Trump is one or two cards away from winning the whole game, or the whole shebang, the whole lot, the whole jackpot, right, on the table in the poker game. We don't know. So I think you need to see what's going on now as a poker game between President Trump and Joe Biden, and then there are other players at the table. But Joe Biden and Trump are like the primary players. But because the final result may be that other people benefit more than Trump or Biden, right? Which means technically, from a standards point of winning, they may have won. They may be independent. They may be on Trump's side. They may be on Biden's side. They may be blended. So there are a lot of players at the poker table. I think that's the better way to look at it. You could see the Pope as one of the poker players. You can see evangelical leaders like Franklin Graham as the poker player in the table as well. John MacArthur. There are people who are like Bill Gates, who's also a poker player there on the table. There's Dr. Fauci, who's also at the poker table. And there's Mitt Romney. There are different politicians who are also playing poker. So they have their own thing that they're looking for, and they want to win the pot. And there may be people who want to run for president in 2024 who are also playing as well. So there's a lot of players at the poker table, and the poker game isn't over yet. And if President Trump draws some key cards, he can win the whole shebang and continue for 4 years as president. That's still possible. I know CNN says, it's over, but it's not over until the fat lady sings, and the fat lady hasn't sung yet. I don't know. Have you seen the fat lady sing yet? I haven't seen the fat lady sing yet. So we don't know. I mean, anything could happen. We're early, right? We're still in early December. I mean, we have over a month to go. This is a poker game, you know? Think of it as like people are still drawing their cards. We don't know what's going to happen, you know? Um, yeah, I know CNN is trying to like, dub, Biden as the winner, but life is not that simple. And anybody who studied history know life is not that simple, because this race is so close, it could go either way, even now, But obviously, President Trump can fold. Who knows? He may do that. Um, if you fold, you automatically lose, right? So that's the point of poker, right? Do you continue playing? Do you bluff your way because you can win with a bluff, right? So maybe President Trump doesn't have the cards, but he's bluffing, but he may still win because in poker game you can win with a bluff, right? If you're good at it. So I think you need to see this as a poker game more than anything else, because there are so many moving parts. So who's the best poker player? I think that's the way to look at the presidential election. At this time, it's the test of nerves between Joe Biden and President Trump. President Trump's been pretty steady as a poker player, but who knows? He may lose his nerve and fold. That's always possible. But President Trump did not get to where he is by folding all the time, right? So he may not fold. We'll see. I mean, I don't think you should give up on Trump winning yet. Whether you're a Trump supporter or you hate Trump, I think that is still possible. I'm just stating a fact here. President Trump is using all different strategies to try to win, and he may. That is still theoretically possible within the democratic system that we have. Well, let's go back to California issues stay at home. So the first article says California introduces regional stay-at-home order based on ICU capacity. And this article is by Sammy Kayola, Chris Hagan, Scott Rodd, Nicole Nixon. The significant quote from this article is the order ends all operations at the following businesses. So the stay at home, if you come under that order. Indoor and outdoor playgrounds, indoor recreational facilities, these will be all closed. Hair salons will be closed. Barbershops will be closed. Personal care services will be closed. Museums and zoos and aquariums will be closed. Movie theaters will be closed. Wineries and bars will be closed. Breweries and distillery, family entertainment centers will be closed. Card rooms will be closed. Satellite wagering casinos will be closed. Limited services will be closed. Live audience sports will be closed. Amusement parks will be closed. Retail stores, however, and shopping centers are permitted to still remain open at 20% capacity. And restaurants can still open for takeout only because people need food, and a lot of Americans can't cook. Although, if you have a microwave, you could always have like microwave dinners. They're fairly cheap and available in your grocery store. So, but obviously it doesn't match like takeout food from a restaurant, which is really good. It's just really yummy. Especially like Chinese food takeout and Korean food. I think they're providing takeout as well, like Korean restaurants in Arlington, Alexandra Falls Church of Fairfax County. Yeah, so go and take out some Korean food. You'll like Korean food. Korean food is great. If you have a lot of money, this is a great opportunity to try out all different kinds of foods, through takeout. So second article, Alameda County, which is in California, could get new COVID-19 stay-at-home orders if regional ICU capacity drops below 15. So that's by Supriya Yelimeli in Berkeley side. And so the significant quote from that is, Alameda County, which is in the Bay Area region of the new guidelines, currently has about 30% ICU capacity. Governor Gavin Newsom today announced a new set of shelter-in-place orders that will go into effect in Alameda County if ICU capacity for the Bay Area drops below 15. So California has decided ICU capacity as the marker for imposing state, regional stay-at-home order. So it's creative, to be sure, creative on the part of Governor Newsom. And, many people feel it's fair because it's regional. It's not like the whole state is not shutting down at the same time. The question is it going to be effective? So that's the problem here, because let's say you shut down, one region, people from that region, especially near the border areas, could just go to the other region. They could drive there. It could be like 15 minutes away. It's like being in Arlington from here. It takes me about 2 minutes to get to Falls Church, which is part of Fairfax County. It takes me like what, 5 minutes, 7 minutes to get to city of Alexandria. It takes like what, 10 minutes to get to DC. You see what I mean? So different regions, we don't have borders here, So if you don't have borders, you could go back and forth between regions. So the question is, will this strategy work given the fact that there are no borders between the regions? So that's a confounding factor or a problem that Gavin Newsom, the governor of California, may not have thought about, but that is a real problem, right? So what may happen in California is, it's kind of like you try to, you use an air conditioner for in one room and you have 4 rooms. Eventually, warm air mixes with cold air, and then your whole apartment becomes cool, even though you turned on air conditioner in one area, because there's diffusion. So the process of diffusion may work in California, meaning one region may shut down because of COVID-19. People from that region may drive 30 minutes to another region which is not shut down to get their hair done or go to a movie theater. And then eventually that nearby region will shut down because they're, COVID-19 will spread and ICU beds will fill, right? Or another way to look at it is if all the ICU beds are filled in this one region, eventually everyone who needs an ICU will be sent to a next region by the hospital itself, which doesn't have capacity. So hospitals will be sending patients to other regions, by helicopter or by ambulance. So eventually, there's going to be diffusion of ICU patients throughout the state who will be transferred to different regions with remaining ICU beds. So eventually all regions will come under a stay-at-home order. Interestingly enough, that may have been anticipated by Gavin Newsom, and maybe that's the strategy that he's using. It sounds like a fair strategy. He's anticipating eventually you have saturation in all the regions, and then everybody will come under stay-at-home order. But he's thinking maybe, oh, this makes me look good because I'm, providing this plan that seems fair. So maybe he's being a smart politician about this. Who knows? I mean, he may have hopes to run for president. You never know. Gavin Newsom may want to run as a Democratic presidential candidate in 4 years or 8 years or whatever. And maybe this is, a way to kind of make his mark in COVID-19 because the whole nation is paying attention to what's going on. Or maybe he's just, trying to survive as a governor. And he's just using the strategy to make it seem like he's being fair, kind of like being a Solomon about it, But let's see, if it's effective, right? At the end of the day, whether the policy is a good policy or not is proven by the effectiveness. So if California has the most death of COVID, then obviously this policy wasn't effective. Maybe Governor Newsom should have shut down the whole state with a stay-at-home order, and that might have saved more lives. So at the end, by June, history may prove that Gavin Newsom did not go far enough and that he's coming up with this kind of wishy-washy policy, according to maybe some people, maybe the reason why, California has over 1 million deaths. Like, some people may say, you should have gone cold turkey and just shut the whole state down. and then they would have, and the flatten the curve and then reopen, So um, let's see, which strategy works. Most likely every governor will use something different, maybe blending of different ideas. So we can compare the strategies used by different governors. We have 50 governors. So what that means is we have 50 different leaders who will use probably different strategy. I mean, non-original people will just copy California governor's strategy, and then historians will talk about it as the Gavin strategy or the California strategy or the Newsom strategy, because historians like to label things. So let's see if Newsom strategy is a good strategy or not, right? As I said, the only way you're going to tell which strategy is best is by comparing different states, apple to apple. So one way to do that is just by strictly counting death numbers, but obviously different states have different populations, so that may not be the best way to compare. Probably percentage of death, like what's the percentage of people who died in the state? You compare percentages to percentages, it's more like apples to apples. Or you could talk about percentages of people infected dying. So if 1,000 people, like per 1,000 infections, how many people died in each state? So that's one way to compare as well. So there are different ways to compare. And obviously good data is you try to compare apples to apples or oranges to oranges to develop a strategy that is kind of comparable. So obviously we still have like 6 months to go. We're in December. We have December, January, February, March, April, May, June, and we're going to have exponentially growing death until then. And I'm predicting that there will be 3 million to 30 million Americans who die by June. So we have still a long way to go. So it's too early to talk about comparing different strategies and its outcome because we still have such a long time to go until June. It's like over half a year. That's like over 130 or over 175 days, right? It was 365 days a year. So it's over 180 days. We have over 180 days to go. So that's no joke. Yeah, so it's too early to talk about comparing outcomes. But obviously for policymakers, they have to think about which strategy is the best. Should we go with ICU capacity? Should we go with infection rates? Should we go with death rates? Right, these are things that every governor has to decide. Yeah, so my gut instinct is going with infection rates is the best way to go because obviously if you have more infections, more of those people will end up in hospitals, and out of those, people end up in ICUs, right? So for me, I wouldn't use ICU capacity as the marker for locking a state down. I would probably use infection rates, especially during the time of flu season. But I think like some of the states which had crazy infections in the summer should have shut down. And had they shut down, things would be different now. But they did. And so that's a problem, right? But I think the best strategy is to use infection rates because ultimately, if you have more infections, you're going to have more hospitalizations, and more hospitalizations will end up with ICUs and then more death. You see how that works? So I think it's better to go with the source, the original source, rather than like kind of go with the outcome, which is the ICU. Because that it may be too late by that time. But let's see. Let's see. I'm going to give Gavin Newsom, governor of California, a leeway. I'm going to give him the benefit of the doubt to see if this works or not. So let's see. So the article says Alameda County, which is in Bay Area of the new guidelines, currently has about 30% ICU capacity. So once it hits 15, Governor Newsom's stay-at-home order will kick into place. So this is dividing the state into 5 regions based on mutual hospital aid, which can expand, obviously. Current mutual hospital aid can expand. Northern California is one region. Greater Sacramento region is another region. Bay Area is another region, which includes Berkeley and Alameda County. San Joaquin Valley is another area, and then Southern California, where Los Angeles is. Third article kind of focuses on the LA County, which is in Southern California. LA mayor issues new stay-at-home order amid COVID-19 spike. So LA goes on its own and issues a stay-at-home order. And that shows us what is possible even within the state. The governor may have his own grand strategy for the state, but the mayors can decide on their own, you know? And so obviously a good mayor will keep the death rates down in his city. But, you know, and you can obviously compare the death rate from city to city in terms of percentage. What percent of the population got infected? What percentage of those who got infected ended up in the hospital? What percentage of those who got infected died? You know, so you can compare data to data from city to city. You know, in a sense, you know, this may be more fun than, you know, using baseball data. There are so many cities, there are so many states. It's kind of like trading baseball cards. You know, they compare data to data. You know, you and your children can engage in data study of COVID-19 from city to city. It could be an activity for your children, for your family. It could be a learning experience. They could learn about science, about pandemic. And it could be a bonding experience for mom and daughter, or father and son, or, you know, you just have to get creative during COVID-19 to provide educational opportunities for your children. Obviously, this is a golden opportunity from one vantage point, because we actually have this global pandemic actually going on now. So it's not theoretical, it's real, which make it more interesting for your children, and you could get them more engaged in it. And by studying this, you're kind of helping them to develop scientifically, mathematically, in ways that they would not have had there not been a global pandemic. It's kind of like if you compare like baseball cards and the data from player to player, it kind of improves the mathematical skills of your children, because they, you know, they're comparing the batting averages and stuff like that. So you can use whatever there is around the world to provide a learning opportunity. And so if you're a good parent, obviously you do that. The third article focuses on city of Los Angeles, or Los Angeles County, right? So LA mayor issues new stay-at-home order amid COVID-19 spikes. So city of Alexandria in Virginia, which is next to Arlington County, the mayor could issue a stay-at-home order as well, right? And that's always possible. So this is by Kenneth Garger in New York Post. And the important quote from this article is, Los Angeles on Wednesday night issued an emergency order, so that was last night, directing all city residents to stay home amid a surge in coronavirus cases. Residents are still permitted to leave their home for certain essential services, including for healthcare like to hospital and grocery shopping. Banks, media outlets, and like, you know, Metro PCS, you know, where you go and you can pay your monthly fee or get, you know, kind of get services. Post offices are also deemed essential, so they're open. But most public areas, private gatherings of people from more than one household are prohibited. So you can't mix with other households. Like you have your family at your home where you live under your one roof, and you're supposed to just socialize with people in your one roof, which is the safest way to go. That's what I've suggested months ago as the way to survive COVID. So had they implemented this strategy earlier on, you would not have the kind of the infection rates that we have now. Because, you know, there are countries with like 0 people dying per day right now around the world from COVID, because, you know, they have kind of, you know, maybe it's their culture, they only socialize it with their household, or maybe they implement a policy artificially to make that happen. So there's just nobody dying in the whole country every day. But that's certainly not the case in America, tragically. You should have followed my advice. It will be in a complete different place had you followed my advice from April 2nd to now. Yeah, which is yeah, that's the tragedy. You know, I am the Leonardo da Vinci of 21st century, so most of my recommendations are good and will work. But obviously, you know, for it to work, you have to take the advice. You have to take the recommendation. So obviously, you're not a slave. You do what you want. People go bungee jumping all the time because they think it's fun, but sometimes bungee cord breaks or there's an accident and you die. There are people who go skiing and then there's ski accidents and people die sometimes, right? So, you know, you take your risks and then you have to suffer the consequences of that risk. You know, you're not slaves, so you do what you want, but there are risks to any decision you make. Um, but most public and private gatherings of people from more than one household are prohibited, the order said, except for when attending church or a protest. So, you know, it seems like it's a fairly reasonable, stay at home order for a city that's like in a hotspot. I would have to say, to be honest with you, I guess America City is kind of, you know, kind of making a good stay at home order for a city with COVID. Obviously, he should have probably issued it earlier because it may be too late right now because there's so much spread already. But let's see. You know, I mean, maybe we will see like significant reduction. But the problem is this, right? Even within the household, there may be one person infected, and that person can go around infecting others. That's the problem, right? If you send a child to school, the child may not get infected for like 10 days, but on the 11th day, the child may get infected, bring the COVID home. And then he may not infect everybody in your family right away, but he may infect the mom, and the mom may infect the dad, you know, and so in some households, you may have everybody die. So the problem now is, and this is a question that you got to ask if you're America Seti, is how prevalent is this? Meaning, how many households have at least one person who currently has COVID, whether symptomatic or asymptomatic? Obviously, it's hard to study that, especially if you're not testing everybody in the state of California. Um, but that's a question you have to ask, right? It may be too late if enough households have at least one person currently infected with COVID, either symptomatic or asymptomatic. It may be too late. So that's the problem of issuing a stay-at-home order too late. Timing is of the essence, right? If you issue a stay-at-home order before you have wide prevalence of COVID-19, like one child per household, one child has a COVID, could spread to everybody in the household, right? Because they live on the same roof. This is why I said close down public schools and do 100% remote learning, because every day a child goes to school, it's a risk for the household. You see what I'm saying? Because the child can get infected, bring it home to the household, to single household. So, let's keep an eye on the Newsom plan or the Garcetti plan. I like the Garcetti plan more than the Newsom plan. Let's see, whether there are several factors, right? Is it too late? You're not going to know unless you're testing everybody. And I don't know if LA Mayor Garcetti has a plan to test everybody in LA. So, if you don't have data, it's kind of hard to make decisions, right? Because we don't know how many households have already are compromised with COVID because, and this is why you got to close down all the schools. If you close down all the schools and your children are just at home, then obviously your home is not compromised because your children are at home. But if your child is going to school every day is a risk. You see what I'm saying? And children are not like adults, right? Adults going to work is risky, but adults are careful. You see what I mean? You don't have adult workers at Walmart hugging each other or kissing each other. Maybe there are some secret lovers who do that in the back room. But for by and large, you have like most workers keep a certain distance from each other. You know, they, you know what I mean? It's just, you know, it's just the way they are. You know, they're not hugging or kissing or exchanging bodily fluids in the workplace. But children are different. You know, children, they like play around, and when the teacher's not looking, they may take off their mask, or, you know, they may stick their tongue out, or, you know, and if they're like teenagers in puberty, you know, it's harder to like keep a distance, you know. Kids like to touch each other, especially in puberty. And you see that in middle school all the time because, you know, they're at that age. And so, you know, they may not do that when the teacher's seeing, but, you know, you know, you can guarantee that that's going on every day in the middle school with kids. And just not with, you know, middle school kids, you know, elementary kids, they just play around with each other, you know. So that's why there's high risk in schools because kids will be kids. Um, and that's why, you know, I worked hard for 3 months to close down Arlington County Public Schools, Alexandria City Public Schools, Falls Church City Public Schools, and Fairfax County Public Schools, although they wanted to originally open. I worked very hard for 3 months to make sure they don't open. And thankfully, I succeeded to convince them that they need to close. Obviously, with your help, because, you know, you heeded my call to contact principals and superintendent and county board members or mayors or city council, and they listen to you as well. So, so we are in this together. We work together as a team to close down the public schools in this area. And that's probably the best thing that you did as a parent to save your family in Virginia's 8th District. So you're very blessed and lucky that Hira Christian came as a candidate for you as Congressman Virginia's 8th District, you know, and had this show. Otherwise, you would not have, you'd have been just like New York or Montgomery County, Pennsylvania, where there's high compromise of COVID right now because they open schools. But, you know, and that's why, you know, leaders make a big difference. That's why we're talking about the Newsom policy and the Garcetti policy right now, right? And because leaders make a difference. Good leaders will make good difference. Bad leaders will make bad difference. You see what I'm saying? So we can compare and contrast what's going on. Unfortunately for Gavin Newsom, California is not doing so well right now. So in terms of his effectiveness as leader in California, you would have to say he's not being very effective now. But I mean, it's still too soon to tell, because by June, some states will have over 1 million deaths. And some states will have, like, you know, around 60,000 to 100,000 deaths. So the goal is to keep the death rate low. You know, so let's see if California ends up having over 1 million deaths or like around 60,000 deaths. I mean, it's hard to escape, you know, having, you know, like 60 to 100,000 deaths for a state like California. This is a big state. But the goal is to not go over 1 million, you see, because that could easily happen in California. So let's see, you know, how effective Mayor Garcetti is in LA, and Gavin Newsom is in California. So let's keep a tab on them. And, you know, from time to time, I will discuss the Gavin plan and the Garcetti plan and its effectiveness. So keep tuning into this show. As you know, this is a daily show. So tune in tomorrow. I'll bring you more important data that you need to understand what's going on, not only in your community, but other communities in America, because we're one nation under God. So obviously you want to know what's going on in other parts of the country, because, you know, we're United States of America. Yeah, so I'll keep you tabbed and informed, and also obviously I'll bring you information from around the world as well, because you know, we are in the world, so we need to understand what's going on in other continents, and failures of other continents or successes of other continents can also give us information on what way we can go to effectively survive COVID-19. So yeah, so tune in tomorrow. I will look forward to seeing you tomorrow. I hope that your family will be well and that your children will be well too. See you tomorrow. Bye.